Hi, my name is Dr. Cotty, and I'm a psychiatric mental health nurse practitioner. Today, I'm going to introduce you to some concepts of cognitive behavioral therapy. And on the website, you'll see a short introduction video featuring Dr. Judith Beck. If you think of a triangle, and we would write the word situation in the middle of that triangle, cognitive behavioral therapy, which is also known as CBT, helps us identify our thoughts, emotions, and behaviors. Picture these on the three corners of the triangle. So we put the situation in the middle and then thoughts, emotions, and behaviors on each side of the triangle. Our automatic thoughts create feelings or emotions. These feelings can cause us to act in a certain way. So people's negative beliefs can be one factor that predisposes them to depression or anxiety when they encounter particular life stressors. When people become depressed, they begin to process information differently, and the same is true for anxiety. So what I would like for you to do now, depending on which particular piece you would like to work on first, if you'd like to identify signs and symptoms of depression, focus on that. And if you'd like to identify signs and symptoms of anxiety, you can focus on that. And there are two links below on the website that will take you to signs and symptoms of either depression or anxiety. So everybody has different signs and symptoms, and it's important to learn to recognize our individual signs so that we can address depression or anxiety as soon as it starts. So pause here for a minute and click on the link and start to look and see what signs of depression or anxiety that you might have. You can also identify your own signs and symptoms. I know for me, the second I feel depressed, I stop doing laundry, and the second I feel anxious, I start to feel irritable. So if they're not on the list, it's okay. You can write your own. Okay, so after you have identified your own signs and symptoms of depression or anxiety, we're going to stop for a minute and we're going to practice identifying our feelings using something called the nonviolent communication formula. What is nonviolent communication? So nonviolent communication is a healthy way to use assertive communication. So there are four types of communication: passive, passive-aggressive, aggressive, and assertive. Passive is if somebody upsets you, you just don't say anything. Passive-aggressive is where you say something kind of sarcastically. Aggressive, you might explode, blow up, name call. What we're going to do is use assertive, healthy communication. It helps us to share our wants and needs. It sets boundaries and it's respectful. Everybody has the same feelings. Everybody has the same needs. And so sometimes it's easier to connect when we use this language. There is a link on the website that has a list of feelings and needs. If you want to go ahead and open that now. So nonviolent communication is a four-step process. It starts by stating a fact. So when you leave the dishes in the sink, then you identify a feeling. I feel angry, frustrated, mad. Next, ask for what you need. I need consideration and respect. Finally, ask for what you want. Do you think you could rinse the dishes and put them in the dishwasher? Since we all have the same basic needs and wants, when we learn to identify them and communicate them in a healthy manner, that's really important. So note, there's no name calling, no put downs when we communicate in a healthy way. You can't say, but wait, when you don't make the bed. If that happens, just say, hey, I'll talk to you about anything, but first, let's process this. So when you are going through your day, sometimes you might not even be able to identify your own feelings. And just having this sheet with you can help. So if you have a really strong emotion and you don't know what it is, you can pull this out and be like, okay, what am I feeling right now? What do I need? And sometimes just identifying them, you take a deep breath and you can say, okay, I can give myself what I need. I'm going to just try and take a deep breath, regroup, and then the feelings sometimes will lessen in intensity. I know that works for me. But the very first step is that we have to identify what those feelings and needs are. So think of a time you had either a strong emotion or a behavior you didn't like or a negative thought. So we're going to use this event to practice how CBT works. So if you draw a triangle, I want you to put the situation in the middle and then think about what your automatic thought was and put that at the top of the triangle. You can use the feeling list to identify what you were feeling and put that on one corner of the triangle and put the behavior on the other corner. So we have a situation in the middle, a thought, a behavior, and emotion. For now, what we really want to do is start to analyze what our automatic thoughts are, what we're feeling, and how we're behaving as stressful events arise. Remember, people's negative beliefs can be one factor that predisposes them to depression when they encounter particular life stressors. And when people become depressed, they begin to process information differently. The same is true for anxiety. So when we look at these examples, we can see how our automatic thoughts can change our behavior and our feelings. So an automatic thought is when an event happens and a thought pops into our head. So there's a worksheet that's going to help you look at how two individuals can experience things differently. And when you open the worksheet, we'll go ahead and do that now. We'll go over the first example together, and then you can pause and go through the rest of the worksheet on your own. So in the first example, Jason and Kurt both receive a negative evaluation at work. Jason thinks, I can't do anything right. I bet I get fired because of this. Jason feels depressed and nervous. Now he avoids his boss because he believes he's in trouble. He feels nervous and that the next time he's confronted with challenging work, and he'll perform poorly. Kurt has a rational thought. I guess I didn't work hard enough. I'll have to come up with a better plan for next time. Kurt feels disappointed but motivated, and he seeks out his boss to talk about how he can improve. He approaches his next task as a challenge and gradually improves. So you can see how the negative thought that Jason had, I can't do anything right, is impacting his emotions and his behaviors. And ultimately, it's going to impact how well he does in that work situation. So as you work through the examples, you'll also get a chance to write your own rational thought. So please take a minute and go through that worksheet now. Each week or each session of this particular website, we give you a healthy coping tool. So this week there is a guided meditation, and it's 3 minutes long. Do you have 3 minutes a day where you can fit this into your schedule? Our goal is that you attach new behaviors to something that you're already doing. So if at night before you go into bed, if you plug your phone in, just push play on that 3-minute guided meditation, because when we attach a new habit to a habit we already have, we're more likely to continue doing it. I want you to keep track every week of how many times you've tried your guided meditation. And when you do this, I want you to spend 2 to 3 minutes thinking about your automatic thoughts this week. Give yourself credit for the work that you do. When you start to pay attention to your automatic thoughts, what you're feeling, and how you're behaving, we can start to identify cognitive distortions. And there's a list of cognitive distortions on this page. So cognitive distortions include things like black or white thinking, I have to do a great job on everything, fortune telling, you make negative predictions about what will happen when other outcomes are more likely. Labeling, you put a negative label on yourself. I'm a failure for making a mistake. So as you read through these, see if you recognize a pattern in your negative thinking. So the very first thing that we do is we just start to identify our thoughts and feelings and pay attention to when situations arise, what we're thinking, what we're feeling, how we're behaving, and then try to identify if there are any cognitive distortions popping up. Remember, this week we can try to use nonviolent communication if situations arise. So when you do this, I feel this, I need this. How do you think we solve the problem? When we can speak in a way that's assertive and calm, we're more likely to get our needs met. Again, the goal is just 5 minutes a day, use a healthy coping tool, and process what am I thinking and feeling. All right, I will see you next time. Thank you.